Hello, everyone. Thank you for watching my presentation. This is a presentation of design research that is done between me. I'm an assistant professor in the graphic design program at California State University, Long Beach, and my research partner, Dr. Gabriela Hancock, who's an assistant professor in the Department of Psychology, Human Factors. We are working with a team of students that grow in the past 3 years from 7 students now to 20 students who are dedicated to this project. In fact, they have kept our weekly meetings since 2019 till now. We had weekly meetings even during the summer. And I'm really thankful to have such awesome team members. This is an interdisciplinary research project working on evaluations of ECU device. This research is done between collaboration between Cali State Long Beach and the support of the administrative management of the VA hospital in Long Beach. We are conducting the research on ECU device, environmental control unit, which can be operated through touch screen, eye tracking, sip and puff, and sound. We divided this project into 4 phases to first perform heuristic evaluations, and based on the heuristic evaluations, file for IRB to be able to interview with patients and conduct A/B testings, and then transfer the results of our A/B testings to enhance the design of the interface for the device to enhance its usability. We defined 4 tasks for the heuristic evaluations. The first task was to make a phone call, then compose an email, then turn on the TV, and then the last one is to adjust the foot positioning or the head positioning of the bed. This device is used in spinal cord injury rehabilitation centers, and we perform these heuristic evaluations based on the Nielsen-Norman's 10 heuristic for interface design and Schneiderman's 8 golden rules for interface design. The first step of this task was performed in the fall of 2019 with 7 students who got training on heuristic evaluations. We went to the hospital campus and we performed the eye tracking and touchscreen evaluations on the device in the hospital. The results of those research were published in 2020 in HCI International and HFES conferences. We were getting prepared for the phase 2 to apply for the IRB for the hospital and for the university to be able to interview patients and do A/B testing with patients based on the design improvements that we did on the device through the findings of our first phase of heuristic evaluations. But the pandemic happened and we had to put everything on pause. So we came up with an alternative solution. We decided to make a prototype of the device, a replica prototype of the device online, so we can continue our A/B testing with the neurotypical population of our own, which is our own students at California State University, Long Beach, because due to the pandemic, we could not go back to the hospital anymore. So in the summer of 2020, the students and the team worked tirelessly. We deconstructed the device and we worked with the manufacturer. We contacted the manufacturer and they were very supportive of our initiative. And we came up with a replica of the device, a prototype. For this purpose, we chose the software Figma, and we created a prototype of the device. In this screen, you will see in the first row, it is the actual device, and the bottom row are the prototype that we built based on the actual interface. We made 4 tasks for this prototype, which were exactly the same as the heuristic tasks that were defined for making a phone call, calling the nurse, adjusting the bed, and composing an email. These are some of the screens. For example, on the right section, you see the beta version, which is a design iteration based on the heuristic evaluations. For example, we find out that some of the screens do not have a go back button. So we added that, and now we call this a beta version. So through this online system that we developed, we could continue our A/B testing between the beta and alpha and perform a user testing again online. At the same time, we started doing a total revamp for the design, which we call it the Omega version. And these 2 tasks are going simultaneously. Right now, we are working on the design, and the A/B testing and the data collection is still going on. We have collected 75 hours of user testing with our own students at Cal State Long Beach after we filed for the IRB with the university. This project has been supported by the manufacturer since the beginning, the accessibility services in Florida. We are very thankful for their support. They even donated a device to us. So once we go back to campus, we can conduct the research without need to go to the hospital grounds anymore. This project has brought the students from graphic design program, human factors, and health and nutrition science all together. We have a team of 20 students from different backgrounds, and this project became a design thinking incubation for learning hands-on design practices. For example, students in graphic design, they learn interface design, but they don't get into user testing. And students in the human factors, they are experts in user testing and evaluations, but they were not, it's a great opportunity for them to learn about prototyping and design solution problems, solving design problems. We used Slack for team communication in this project and also Zoom. We tested almost all of the available prototyping tools in the market, and we chose Figma at the end for its accessibility and versatile platform. Also, we used ProtoPie for some of the dynamic, for example, we needed to create the task for the phone test, and then we needed the keyboard to respond to the JavaScript if the user can type the correct number that we were expecting. And ProtoPie give us this option. Sketch also developed, we contacted Sketch, and then they developed a plugin for us to be able to conduct this research phase. Our long-term plan is to work with the manufacturer to enhance the usability of the device and be constantly sharing our findings with the manufacturer. This research has brought students from 3 different majors in California State University, Long Beach, School of Arts, Department of Psychology, and Department of Health and Human Services. And here is the shot of the team members, which I call them the dream team. And thank you very much for watching this presentation.